Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
In this part 2 of our series on estrogens, now that we talked about where they come from, I'm going to sort of focus on what we should expect as far as levels are concerned in general, because this estrogen that we're aware of has 3 primary forms. E1, as we talked about, estrone, E2, estradiol, and E3, estriol. Now, each of these estrogens have different levels through the menstrual cycle and through post-menopause. Let's talk about the menstrual cycle first. Follicular phase, which is day 1 to 14, estradiol, E2, is the most potent form of estrogen. And during the follicular phase, E2 gradually rises as the follicles and the ovaries mature. Now, this increase helps thicken the uterine lining, which we call the endometrial lining, in preparation for, of course, a potential pregnancy. Estrone, E1, is a weaker estrogen compared to E2 and is certainly present in lower concentrations. Its levels are relatively stable, but it can rise slightly as the E2 rises. Now, E3, which is the weakest form of estrogen, during the menstrual cycle, it really stays level and stable. It typically goes up, as we called from before, during pregnancy. Now, let's talk about ovulation, the second part of the menstrual cycle. This is around day 14. Estradiol levels peak. They release the luteinizing hormone. It helps to release the egg from the ovary. And E1 may also show slight increase that we talked about, but not as prominent as E2. Now, the third phase, which is called the luteal phase, days 15 to 28, after ovulation, E2 levels initially drop, but then rise again as the corpus luteum forms. If pregnancy doesn't occur, E2 levels will decline. That leads to menstruation. E1 levels again follow the patterns of E2 and E3, again remains pretty well the same. Let's go past the pre to post-menopausal. Now, after menopause, the ovaries significantly reduce the production of hormones, particularly estrogens. So estradiol, E2, that we've been talking about, these levels drop significantly as the primary source because it comes from the ovaries, which are not active anymore. So now estrone, E1, becomes the prominent form of estrogen post-menopause, and it's produced in the adipose tissue, as you remember, from androgens. And why E1 is now higher than E2 post-menopause, they are still lower compared to premenopausal levels. E3, estriol, remains low, similar to premenopausal non-pregnant states, as it is not significantly produced outside of pregnancy. So what about with hormone replacement therapy? You have a patient, you see someone that's doing it. Well, they do that, of course, to alleviate symptoms of menopause and of aging. The specific levels of E1, E2, and 3 vary, depend on the type of therapy and the individual's response. But in a general overview, you might expect things like when you use bioidentical hormone therapy and you're including combinations of E1, E2, and E3, which you're customizing to the individual needs, you're going to see those levels change in E1, E2, E3 as you assay them. But that careful monitoring is important to avoid too low and, of course, too excessive levels as well. Sometimes E1 and E3 are added to the combination, and that will vary, of course, depending on the formula, but E1 may increase anyway due to what we said, peripheral conversion, and E3 sometimes is included as well. So the real strong estrogen, as a summary, during the menstrual years of a woman's life, typically, of course, are E2 or estradiol. That initiates pretty much the cycle, and it tends to, of course, lead to eventually its reduction in the menstrual cycle actually beginning to, the menstruation to occur. When it is post-menopausal, then the levels of E1 or estrone become more prominent, And you should be aware of that. Even though it will never be very high levels, it is more prominent as E2, no longer being produced by the ovaries appropriately, takes a step back. In part 3, we'll start talking about treatment options, how to look at some of these levels and make sense of it depending on where that particular individual is in the cycle. We'll often bring up again men and where they will be on these levels as well in our next parts of this program. Thanks for watching.